health specialist, medical educationist, and palliative care specialist. Currently, I work with one of the leading institutions in this country, a national government organization, Mount Uganda, contributing to communities equipped for health and development. I'm glad to be a contributor to the evolution of health and development in Africa and Uganda in particular. We have seen our contribution evolving from time to time. I'm glad that we are now focusing on leadership in health and development, which is a very important aspect, a need in this season. Without leadership, we can't go very far, because leadership is influencing. Leadership is envisioning, looking at the future of health, with the experience we've seen with HIV as an epidemic across the globe. Then COVID-19 recently, we see that without leadership, health can be compromised, development can be compromised as well. A person can ask, why leadership today? The world is angling for people who can empower others. Ability to identify other people as critical resources and developing them to be a force leading to change that can lead to healthier lives, at the same time, development. Because health and development are quite linked. Secondly, envisioning, looking at the future from a distance. How will health be 50 years to come? What will be the emerging health issues 20 years to come? How can the health system be improved, equipped, prepared to meet such challenges with the current challenges, especially in developing countries, and emerging issues? COVID came. It found us with malaria, it found us with diarrhea, it found us with the measles, polio, name it. Now we have additional disease burden. How do we see the system, the health system, 20 years to come? What do we have to do today to make it better, to make it ready to face the emerging challenges? Envisioning, and after envisioning, you need to share the vision with many others. Now, we have primarily been training people. I come from the health training background, having done this for over 15 years. But we equip people to deal with the current. But we also need to equip people to see the future from a distance and be able to get prepared to respond appropriately. Sharing the vision is part of what the health sector and development sector needs. People who can envision and also share their vision. We need people who can inspire others. Health, HIV has taught us that it's not a medical issue. Health is medical, is psychological, mental, educational, economic, across all sectors, spiritual. Therefore, we have learned that we need to inspire everyone to do their honest part and make the change we desire to see. We can't achieve health when we rely on the medical people alone. They are so few in number. To do the surgeries, do the preventions, live in people's homes, be on villages, they can't. The only thing we have is to empower and inspire people to get on board and make their contribution towards the change. That's why today every household is a change agent for health and development. We have VHTs, village health team members, who work with the religious leaders and everyone in the community to improve health. We need leadership. We need schools to hold people who are healthy so that students, pupils, our children are healthy in school. Therefore, we need the engagement of such sectors. Then, we also need a people who can lead change. Change is becoming inevitable. More and more as we draw close to new challenges, we need shifts. Therefore, we need people who can lead change successfully. Change can make you, can also destroy you. We've seen change destroying major companies. One author wrote a book, How the Mighty Fall. Change can either make you or destroy you. Our health and development systems need to be adapted to change so that we can successfully transition from one level to a better one. And we need people who can lead change, and those are leaders that the world lacks today. Moreover, during our season, our era requires innovation, almost in everything, because of the shifts that the world is experiencing. New challenges cannot be approached and dealt with old ways. We need innovation to improve our approaches, to improve our results. As it is said, you can't do the same things and expect different results. We can only get different health results, health outcomes, development outcomes, if we do things differently. And the difference is caused by innovation.